we will explain briefly how to do the respiratory physiotherapy exercises shown in the document sent on April 2, 2020, that you can find in the link at the end of the video, which will give you more details. We should begin with some specifications. These exercises are meant for patients who are COVID positive, in lockdown at home with little to no symptoms, like a little fever, light cough or cold-like symptoms. This therapy is also useful in suspect cases in the same clinical conditions. There is still no evidence sustaining the protocol, that is based on elements of physiopathology of the disease described by colleagues in the medical profession. This physiotherapy does not prevent contagion, but it is aimed at slowing down and maybe stopping the progression of the disease. It does not substitute the therapy prescribed by your GP or family doctor, but it goes together with it. In order to do the exercises you need some equipment which is easily found in your household. A drinking straw or a small tube of similar size needed for the inhaling phase, coupled with a half-liter bottle or a similar container, around 20 centimeters high for the exhaling phase. If you have it, it is better to go through the exhaling phase using a flexible tube of the length of 80 centimeters, together with a 1.5-liter bottle. You need to draw lines on the bottle with a permanent marker along all of its length, 2 centimeters apart for the 1.5-liter bottle, or 1 centimeter apart on the half-liter bottle. You need to fill the bottles with water, up to the middle, then you can regulate the difficulty of the exhaling exercises by augmenting or diminishing the quantity of water, keeping the marks as reference. Let us begin the exhaling phase by inserting the tube into the bottle, that holds the chosen level of water, all the way to the bottom. In the exhaling phase you can breathe air in freely through the nose or mouth, then hold your breath for 3 seconds, and let it out by steadily exhaling through the tube. You need to generate a regular flux of bubbles in the water, feeling its resistance but not getting fatigued. If you do, you can reduce the quantity of water in the bottle for the next cycle. You need to repeat the exercise 10 times for every cycle. You can do this exercise alternatively by substituting the tube and the 1.5-liter bottle with the straw and the half-liter bottle. Let us move on to the inhaling phase, for which you will only need the straw. In this phase you will hold your nose and inhale through the straw, trying to maintain a steady flux and introduce as much air as possible. Again you will need to hold your breath for 3 seconds and then you can exhale freely through your nose or mouth until all of the air is gone. You can then take a small break breathing freely before you start a new inhalation through the straw. This inhaling exercise needs to be done 3 times. In order to improve the ventilation of all the areas of your lungs, it is preferable to go through this therapy changing your posture after 2 therapeutic cycles, both inhaling and exhaling. You can use the same alternating postures even if you do the exhaling therapy with the straw and half-liter bottle. Here we recap the plan of a whole physiotherapy session. Every cycle consists of 10 exhaling exercises and 3 inhaling ones. The session is made of 10 cycles of exhaling therapy, alternating 10 cycles of inhaling therapy. Every 2 cycles you will change posture. The entire session takes a quarter of an hour or more. Let's now see how many sessions you should have in one day. You should start with 4 sessions. And then you can add more, If your clinical conditions allow it, doing one more session each day up to a maximum of 6 daily sessions. If you notice you are getting too fatigued, you can go down to a minimum of 3 sessions. Let's see a few examples of daily plans. The timetable of the sessions is customizable to your daily routine, trying to keep them as far apart as possible from meal times. What dictates and guides your physiotherapy is the feeling of fatigue. You always need to reduce your effort if you notice that you are fatigued at the end of a session. On the other hand, you can try to increase your effort only if the fatigue at the end of the session is minimal. Some advice. Every straw, bottle, tube, must be considered personal equipment, and should never be shared with other people. Every piece has to be cleaned, or preferably disinfected after each session, or even exchanged for a new one. In this time of isolation you need to avoid or limit as much as possible lying in bed or on the couch, and take time every day to do some aerobic physical exercise. If you don't have any other choice, even running or marching on the spot will do.